Hello, this is Amna. Today I am going to talk about the therapeutic contact lenses. The therapeutic or bandage contact lenses is derived from the Greek word therapeun, meaning to take care of or to heal. Fitted primarily to protect or to promote the healing rather than to provide the refractive corrections. They are mostly plano powered. The refractive corrections are also be incorporated in these therapeutic contact lenses. The classification of therapeutic contact lenses are hydrogel lenses, dispersible hydrogel lenses, silicone rubber lenses, scleral lenses, and collagen contact lenses. The hydrogel contact lenses are of low water content hydrogel soft contact lenses, mid water content hydrogel soft contact lenses, and high water content hydrogen soft contact lenses. The advantages: they quickly relieve the pain, they are easy to fit, they are readily available and relatively cheap, cosmetically in the tinted form. The disadvantages are they don't perform well on the dry eye, they don't enhance the vision of irregular cornea, they accumulate the deposits, and they need frequent replacement. The dispersible hydrogel contact lenses are used for the recurrent corneal erosions, the filamentary keratitis, bullous keratopathy, neuroparalytic keratitis. Their advantages are they can be replaced easily, they are more convenient and cheaper. The disadvantages are the risk of hypoxia, that is low oxygen level, the risk of infectious keratitis. The next one is silicone rubber. The water content is about 38%. They are highly oxygen permeable. They are applicable in tear film dysfunction lenses of choice in chronic severe dry eye. The lens is flexible, so it improves the visual acuity. The indications are the keratinized mucous membrane, trichiasis, incomplete closure. The demerits are hydrophobic, they are more expensive, they are prone to deposits, they increase the time to settle. Next one is scleral contact lenses. They are effective in dry eyes with cicatricial tissue. Their demerits are pitfalls, lack of convenience, they are time taking, they need special expertise. Next one is collagen contact lenses. They are manufactured from the porcine and bovine tissues. They require hydration prior to the insertion. They are used for the lubricating actions. They need not to be removed once it is inserted. They promote the wound healing after the anterior segment surgery. The demerits are inappropriate for a long-term therapy, decreased visual acuity, that is, it lacks of transparency, it provides the greater discomfort. The selection criteria on the basis of the ocular disorder and availability. According to the effect of the cornea, it should be chosen to allow the maximum oxygen to the cornea unless the eye is blind. For the blind eye, it is important to consideration which is comfort. The lens design or material should be changed perhaps several times to obtain the clinical effect best suited to the corneal condition concerned. The essentials of the therapeutic contact lenses fit. The first one is keratometry. The use of topical anesthetic is avoided. Many mask the pain associated with the pure fitting contact lenses. The large lenses for the treatment of looking infiltration blood and the healing of the peripheral corneal lesions. The fitting criteria is the lenses should be fitted so that they move adequately but not excessively. The reduced movement is desired in conditions like recurrent epithelial erosions. The refitting is required at various stages of the recovery. The parameter we should consider is TD, BO, ZR and the back surface geometry. If it is too flat fit, the excessive lens movement is provided, it retards the wound healing process. If the lens is steep lens, it has a little movement, edema and discomfort, trapping of the debris. If it is excessive loose, it leads to the displacement of the contact lenses. The lens fit should be assessed after approximately 20 minutes, and ideally again it is checked approximately after 60 minutes. The functions or aims of therapeutic contact lenses are: they relieve the symptom, they promote the wound healing, that is corneal healing, the mechanical protection and support, and it maintains the corneal epithelial hydrations, and it is used as a drug delivery system. Symptoms relief. It provides the more regular refracting surface. The clinical indications are bullous keratopathy, Fuchs endothelial dystrophy, filamentary keratitis, thigh-extent superficial punctate keratitis, superior lymphic keratoconjunctivitis. The first one is bullous keratopathy. In a patient with a painful eye with no visual potential, it reduces the pain and it leads to some visual improvement. The patient should wear the lens on continuous wear schedule. The lens movement should be minimized but not sufficient to allow the adequate tear flow. The large hydrogel lenses with the high water content is Duragel 75, Lunarlay ES 70, Troy 85. As a temporary measure where the patient is going to have the penetrating keratoplasty. It is a thin water content therapeutic contact lenses is indicated in this condition. Next one is filamentary keratitis, a severe persistent cases which benefit from the use of the therapeutic contact lenses in conjunction with the steroids and atropine or the removal of the filaments. The disposable contact lenses are most commonly used. That is mainly Wesley, Zizen, Precision UV, IQV, Bausch & Lomb soft contact lenses 66 and the Pure Vision. The next one is superior lymphic keratoconjunctivitis. It alleviates both the signs and symptoms of the disease. Its relatively large therapeutic TD soft contact lenses are used. It promotes the corneal healing. The clinical indications are the recurrent corneal erosions, the traumatic corneal aberrations, the persistent corneal epithelial defect, anterior membrane dystrophies, and chemical injuries. It is used as a post-operative epithelial disorders such as vitrectomy, trabeculectomy, post-penetrating keratoplasty, epikeratoplasty, keratorefractive procedures, example PRK and LASIK, the cataract extraction, that is wound leakage, positive CDL test. Soft and collagen therapeutic contact lenses minimize the post-surgical epithelial trauma. Thank you.